I'm Takahiro Suzuki. I would like to present our palpation system with wearable tactile sensor. Contracture is restriction of the movable range of the joint, which is diagnosed by palpation by physical therapists or doctors. Palpation is a subjective diagnosis, so it is difficult to share the evaluation among other therapists. In addition, the diagnosis depends on the high skill and experience of each therapist, so the diagnosis result may differ from one therapist to another. For these challenges, we have an idea that quantification of the therapist's tactile sensation during palpation. As an important indicator for quantification, we propose the frictional vibration. It is induced by sliding disturbance of soft tissue around the joint during palpation. We have developed a simple and compact system for contracture diagnosis. The system uses a wearable tactile sensor to quantify frictional vibrations. The sensor uses skin-propagated vibrations, so the therapist can directly touch the object and palpate it without losing their own tactile sensation. By processing the signal recorded by the system, the frictional vibration appears as an intermittently pulsed waveform. In our paper, we propose a method to evaluate the degree of contracture by focusing on the pulse density, which is the frequency of pulses per unit of time. In the opinion of the therapist, the stronger the contracture symptom is, the higher the pulse density is. We will explain how to calculate the evaluation measure. First, the pulse detection is done from the sensor output. Next, we prepare the travel time interval and calculate the pulse density for each of them. Then, the pulse density is accumulated, and from the larger 50% of them, we calculate the mean pulse density and used as a measure of contraction. In order to investigate the ability of our sensor system, we conducted basic experiments. In the experiments, 11 young participants were palpated, and the target joints were knee, shoulder, and waist. Palpation was conducted 10 times, and even number of palpations were recorded. Therapists evaluated the degree of contraction on an integer score of 1 to 3. Experimental results showed the mean pulse density of the sensor output had a good relationship with the subjective ratings of an expert physical therapist. The result also showed that the mean pulse density tended to decrease as the number of repetitions of palpation increased. These results showed the usefulness and validation of the proposed sensor system. Thank you for your attention.